Just because I show up and clock in as an LPN, that doesn't absolve me of my education, training, and knowledge and my duty to the patient that is tied to my educational knowledge. And that's what makes it malpractice. My level of education. That negligence is different because I have a body of knowledge that now ties me to so many things. And that's going to be layered on not only from my, and I'm going to talk about me, my associate's degree, my bachelor's degree in science, my master's degree in science. They'll be looking at my resume. Well, what kind of type of nurse were you? Well, tell me about that. You had TNCC, you had trauma nurse court training. You worked in the ICU, you were a critical care nurse, you worked in the cath lab. All these things are just going to be layered on. So then my body and knowledge is going to have to dictate what my duty to that person was, my level of responsibility that will bind me to that person because of that, my education, training, and knowledge. I taught ACLS. I taught BLS. I just can't stand by and watch. That's not how it works for me because I am a critical care nurse who taught BLS, who taught advanced cardiac life support. So therefore, I just can't stand by and watch. That's not what my education training, that's not how it works for me. Not how it works for any of us. So our education, training, and knowledge is what will dictate what our duty is. And the duty is the big loaded word, what a prudent nurse would or would not do in the same or similar circumstance. What a prudent doctor, physical therapist, rad tech, nursing assistant, it doesn't matter. Once you have a body of knowledge, that's what ties you to a standard of care that is upheld within healthcare and can be negligence, gross negligence, depending on your level of education and what you should or should not have known.